Good morning, everybody, and welcome to Skincare Q&A. Today, we are going to delve into the world of treatments with my favorite expert in this field to give objective advice. We are going to look at pigmentation, skin sagging, and skin texture. Now, for those of you who think treatments are beyond me, we will also be looking at what are the skincare products that you can use in these categories as well. Well, let's get on without further ado. Alice Hart-Davis, and we'll start off on pigmentation.
Hi,
Hello,
Trinny.
my darling. How are you?
I'm okay.
So we're going to start off with something that they all ask a lot about, which is pigmentation. Just to describe it, it is when your melanocytes between your epidermis and your dermis, they kind of come up through and they can come in slightly bigger amounts so that you feel you have what we could call age spots.
Melasma is more hormonally driven usually. I mean, you can get it in men, but it's usually a female thing. Yeah, pigmentation is driven by, we all have these melanocytes in our skin. They're what give it its color. You know, if we're fairer, we have fewer. If you're darker, you have more of them. And they create the pigment in response to the ultraviolet light that's coming through from daylight, not just sunshine, but daylight.
It's sort of, you know, hormonal pigmentation versus, you know, just sun pigmentation. Do you think you treat them the same?
The difficulty is whether to what extent you can control that hormonal fluctuation, because you may or may not be able to do that much about it. You know, obviously you can act on the symptoms, the stuff that's coming through and showing on your skin. I mean, the best solution for it is really prescription skincare from a dermatologist to use the kind of ingredients that will really get it under control. And then sunscreen, totally, always sunscreen, because that's what's kicking off the pigmentation in the first place and will make any pigmentation you've got worse.
Would you say, because some people talk about Cosmelan, which is a treatment you get in a dermatologist or at a beauty therapist, and then you do the rest at home. What do you think of that?
Can be helpful. I was talking to Deja Ayodele, who runs the Black Skin Directory and is an esthetician in West London here, and she has found that very useful. So, you know, some people like it, some people don't. I haven't tried it myself. Yeah. But, or you can try the other things that aesthetic clinics have, the Tweakments clinics where I go and hang out. They will have regimes like the Abaji New Derm regime. Do you do that one? It's quite.
Yeah, I did do the Abaji New Derm after I had Lila, actually, and that's quite a strong one. And it did used to contain hydroquinone, which is for some countries now a banned ingredient and getting on those lists. So I think it's a very strong treatment. It did actually help my pregnancy melasma too. I mean, it was going to go anyway with hormones, but I kind of want to accelerate it going. And then somebody asked about microneedling, and I have, you know, done my own little at-home doctor's surgery moment, Alice, as I do. But I built up really slowly. I started with vitamin C, gentle vitamin C. I did like deep sea garden of wisdom. That's a good starter. And it goes in and it converts in a soft way, so there's no aggravation on the skin. It's a slightly different form. It's a contained form of L-absorbing acid.
Vitamin C is fab. I'm really cautious around home microneedling, Trini. I know you know what you're doing with it. My worry is that saying to people who aren't so sure of their skincare ingredients is used that they microneedle randomly. Derms are always telling me they see people with these kind of scratched up skin surfaces.
I think I totally agree with you. I always say start with a 0.2 needle. Minimum invasiveness, do light feathering motions for the first couple of weeks. Don't do it with any other skincare products. Just do it to sort of damage the skin so that it will kind of heal itself. Don't prick with blood. Let that be a dermatologist.
You're not going deep enough with home microneedling to get the wound healing. All you're doing is making holes in the skin. So it's letting products deeper in. So the question is whether those products are okay to go deeper in. And if they're a lot of normal high street cosmetic skincare, they may well contain the kind of preservatives or essential oils or some kind of fragrance. A lot of products have fragrance that will just make skin kick off. So that's why it's risky.
I would never ever suggest somebody does microneedling and does any form of essential oil afterwards or anything with fragrance in it. These are all, you know, whenever I discuss them, Alice,
you're really wise on it, but I just feel people sort of get the idea and then they go off on a random.
You know, we're very careful about how we discuss these things, and it is very important to do things correctly. So if anyone is considering microneedling, watch my film on microneedling. it is for me a way to channel products, go a little bit deeper. And if it's a great product and I think it goes deeper, I always suggest products you should use with microneedling. You know, a lot of people will be in a car and they'll get much more pigmentation where the window is down, because sometimes we're in the car and we don't remember to put on SPF because we don't think we're getting out that day, and we just get one-sided pigmentation.
But Trini, the UVA comes through glass, so it'll get you in the car, you
Whatever.
know, more on that side. But yeah, so sunscreen the whole time. Yeah, I did really well with pigmentation during lockdown just by lying under a clinic strength LED light, which is
okay. So tell me, does that help for you? LED light pigmentation?
Yeah, totally. I mean, if it's strong enough, it's got to be clinic strength, and this is a Dermalux, which is like the gold standard. And because I didn't have any other Tweakments to go to during first lockdown, I would lay under this most days, half an hour, and it's brilliant. And it's got red light for creating hydration in the skin, strengthening the skin. The net result was after 3 months, I went scuttling back to the nearest clinic to get a Visier reading on it, and it knocked 9 years off my skin age with
fantastic
bit more hydration, bit less pigment. So I was really surprised by the pigment because I didn't really know it could do that, but it was quite clear.
To me, it's about how often you do something. It's like if you do a skincare regime every day, there's a chance, to my mind, you maintain a much better skin, whatever treatment you might or might not do. So it's just that repetition. Let's do some questions, Alice. How often do you need to have a salon Dermalux to make a difference? I mean, I'd say if you did one every month, it would be nice. If you did one every 2 weeks, it would be fantastic.
Ideally, they'd say twice a week for 4 or 6 weeks.
Okay, and then
it's a cumulative benefit. So the more you do it. But yeah, there's plenty of people derms will say you spend your money on that rather than on a moisturizer, you get better results. So
What about
tranexamic acid? Very, very trendy, popular, can be useful as part of an anti-pigmentation regime, possibly, but I would want to do it under guidance from a dermatologist. You know, that's taking tranexamic acid orally, not not as a. It's quite trendy as a skincare ingredient. There's not an awful lot of proof behind that. There's a lot of talk, but some derms will include it in a prescription package.
Should we move on now to sagging jowls?
For sure.
So what most people complain about is, you know, I'm getting this kind of little friend here, and they feel their skin is sagging, which we know is because, you know, the sort of muscle underneath is kind of coming down the face.
It's not so much the muscle sagging, it's because the facial structure is shrinking inside the face. So it's like losing weight inside a tight dress. You know, we're losing bone mass from the bony arches of the face. We got 3 of them around here, here, and here. And we're losing fat volume, and some of that fat is sliding and collecting with gravity under here, which is not helpful. But it's more, and the muscles are a bit like an elastic band, you know, that they will become a bit weary with use and hang a bit looser. But it's not so much skin and muscle sagging as everything else shrinking inside. So what's left has got.
We just don't have such a framework in which to hold our skin up.
Exactly.
Tell me in your mind what you think some of the best treatments are that are not a facelift and not hugely expensive.
You know, Trinny, I was thinking about this, and there really isn't very much, and there's not much that's helpful.
You love New Face, don't you?
Yeah. I love the New Face, and you love your facial exercises, but you know, there aren't any Tweakments that are working on the muscles, and unless you think of a salon treatment like Casey, you know, Casey is it's electrical muscle stimulation, same like Face Gym, like whatever, that they can help tone those muscles, but otherwise, no. I mean, a surgeon will cut and lift and tighten that whole structure over the underlying whatever, but no, it's a really difficult one. Obviously, you know, skincare is not going to do anything for it. I think a lot of the facial exercises just stress the muscles that are overactive anyway. So
I so don't agree with you.
Well, I know you love your exercises, but I think they all just tighten the platysma and
Oh, I love I find when I do it, like when you want to redefine your jawline, just giving a bit there, I really find it helps.
I grind my teeth, so I've got far too many muscles here, and I would like to go and get them shot full of toxin to soften them down a bit. And also
you don't do that little, you know, like this and unrelease them. I mean, I try and do that.
Now, but you know, the trouble is habitually, and particularly overnight, you know, your habits of clenching or grinding or whatever are so strong that nothing's going to stop them. But yeah, new face I love, because that does redefine the contours. It just lifts up the brow a bit. It wakes everything up.
This is a new face, and it's an electrical current machine. So if you do Casey or this or Face Gym Pro, they're all slightly just giving a little current, and you can do them with, they come with a gel, which I don't particularly love. I use aloe vera gel, and I just lather it on, and it just, you know, for me, I think why I like it is I will, you know, do it slowly and it beeps. I used to do very quickly, and I realized I had to do it slowly. And then here on a lower setting, I'll do it like this, and it will give that muscle that ability to just, you know, be tricked into kind of lifting up a bit. And if I do it every day, I do feel there's a consistency in the change of my skin. Moving on to, you've got saggy jowls. Next stage up to me would be threading, and some form of threading is one route you can take. And there are, you know, I would research really carefully. I know that you have a list of people, you know, you have a list of people you think are good, Alice.
Yeah,
if you go onto the tweakmentsguide.com, Alice does recommend people she thinks are good. What other treatments then for sagging jowls would you suggest? Yeah,
it depends on your jowls, obviously, but because some people have loose saggy skin, others have, you know, sort of like double chins or fat bits that have slipped under, and you could try injectable fat dissolving injections. Those work. They make you swell up like a bullfrog, and you have to go through several rounds. You can either freeze it, which is sort of slower but completely non-invasive, or you can have these injections,
fat dissolving injections,
and you swell up, and you'll need more than one round of them. So it depends on your appetite for that kind of downtime, but it can be helpful. Or you know, microneedling, clinical microneedling combined with radio frequency. That's one that's really popular at the moment. Have you heard of Morpheus 8, which is everyone's talking about that, but there's lots of other types like Secret RF or Profound or Potenza. They're all brands of radio frequency microneedling, and they all involve microneedling with like needles that are up to 3 millimeters long, possibly a bit longer, that dive into the skin and then deliver the radio frequency. Radio frequency is a kind of energy that has a skin shrinking, a shrink wrapping effect on the collagen. And rather than burning its way through from the top, this delivers the radio frequency right deep down through the points of those needles. So you get the wound healing effect from the needling, plus the collagen boosting from that. So that can be quite nice. And if the needles go deep enough, which I don't even like the thought of, they can hit the fat, and the radio frequency can sort of melt some of that. But that's but you need a really good practitioner to guide you on this.
What about fibroblast plasma?
No, hate it.
Tell me why you hate it.
All it's doing is doing tiny burns on the skin. It's creating a series of tiny controlled burns on the surface of the skin. It's often used for the upper eye, or, you know, wrinkles around here. And as the skin is burned, it contracts and shrinks, obviously, and then it scabs over, the scab falls off, and you're left with tightened skin. But it's also very possible to get lots of tiny little scars from it. You need several rounds of treatment.
I'll tell you what's really interesting, Alice, is the repose of our faces, I think, during lockdown have changed, because we haven't been in front of so many people, and people stimulate you to smile and to use those muscles. And I found that I got more of a downturn just being on my own here and not being in front of people. So my repose is quite, you know, so I actually now sometimes go around here if I'm on my own. I just do this. I'm smiling and smiling and smiling, and I don't care about creases in the eyes. I just feel, and then if I do that a lot, I have that feeling. So I just have to say, from more emotional and physical, I think it's interesting. Just to quickly recap on what you can do. We consider radio frequency, we can do threading, we won't do fibroblasting for sure. Anything, I mean, Botox, to me, it doesn't, you know, I think it doesn't stop this sag, but I do know for when you have Botox done, and I've had it done for 30 years, you know, putting it here does help a little bit to freeze so that you don't get so much of that. And it's more just for prevention of further increase in the indentations on your face. But
and if you've got tight bits under here, it can help that, and it can help redefine the jawline a little bit. And also some practitioners like putting filler, structural filler in the corner of the jaw and along here, because that disguises whatever is underneath. So because you think,
what's your take on filler now, Alice? Because I think that over the last 10 years, you know, we've seen filler done really badly. We've seen people who have got addicted to filler and done too much. I had a little bit of filler like 10 years ago. I've had most of it removed. You know, filler is, I think it's moved on, because most dermatologists I speak to, they're very delicate with it now. It's not these kind of big chipmunk cheeks, and it's kind of strategically inserted. But are there better fillers now than there used to be?
No, just better techniques and more artistic use of them. I mean, yes, a lot of practitioners prefer just to use tiny bits of filler, but quite a lot of the guys I see and work with use a lot.
We're going to go on now, Alice, to skin texture. So I feel that skin texture can be when you feel there's a kind of, you know, you've got a lot of wrinkles that come together, that kind of skin texture, or it can be that you've got acne scarring and you've just got that, you know, when we go down the path of life, we can just see the skin separation, especially on cheek. It just looks like it's slightly separating. That fineness of skin disappears. So what are good treatments, Alice, to get a great skin texture?
There's a bunch of them. Obviously, skincare first. Obviously, skincare in the form of protection, particularly like you were saying, you know, vitamin C, sunscreen, because what's bringing on the changes in texture, apart from age and losing hormones and the way that affects everything, is UV light, the way it wears away the collagen, the elastin, prompts for pigmentation, and makes our skin look that bit drier and rougher and less good at holding on to moisture, which is critical. So treatment wise, you could try something like an injectable moisture treatment. These are really popular. They're called skin boosters. They're
like
things
Profilo.
Profilo, this one I tried last night, Revive. There's Teoxane Have Redensity one. There's Volite. There's the original Restylane skin boosters. You know, it's been around a decade or so. You know, they're not necessarily that new.
What are they doing, Alice?
They're putting a very fluid form of hyaluronic acid gel, like you get in a moisturizer, but on the inside, and one that holds together just inside the surface of the skin, and it spreads like honey through the skin, and it sits there. And that hydration enables your skin to function better. So it starts making more collagen, making more elastin. It gets firmer, tighter, better hydrated over the course of the next 6 months. So it's really helpful. And it's a real skin regenerating treatment. It's not just putting on a bit of moisturizer, and so that's good. So that's
you've had Profilo and I've had Profilo. I know you said you've tried a new one last night, but I had Profilo the first time, and you have one set, and then 6 weeks later, or how many weeks later, 2 weeks later, you have the other one, and sort of the first one sort of lays the groundwork, the second one works, and after the first one you can see some change, but it's meant to be after the second one you see most change. Now I think at the time I thought, yes, I feel my skin feels a bit more plumped. I didn't feel it lasted hugely long. That was my only thing, Alice, is that I felt after 3 months, what I thought I'd noticed, maybe I didn't notice anymore. Do you think things have progressed since Profilo, or do you think the other categories you've mentioned are all versions of the same thing?
They're all brands of the same thing with slightly different attributes, but it also depends on the person, and dare I say it, you and I are a little bit older than average, therefore, you know, we might need that bit more support, you know. So often, I think the mistake people make with all these is they don't have enough of it. And it's like in the neck, whenever I have it in the neck, I find I need one more round of treatment than I think I'm going to, because the neck isn't very well looked after, doesn't hydrate itself very well. So they do make a difference. Also, that radio frequency microneedling, that's terrific for skin texture, because it's needling, it's creating a new surface, it's generating more collagen. General microneedling, you know, that's fab. That's a good one as well. So
fractional radio frequency, which is in a way what you're saying too. I mean, I found for skin texture, I've been working with Teresa Tame, and she's done my chin and this area, but I found the downtime is maybe a day, but it's working, I think, in the same principle fractional radio frequency, because it's not fractal. Yeah,
absolutely. It's
and I do love that.
Yeah, and it's creating that genuine change from the inside that works its way up to the surface. Or, you know, you can go from the outside in with skin peels. They can help. Most people.
What do you think of skin peels? Because skin peel is an acid peel, like a TCA peel. Or
I mean, that is a pretty strong one. I mean, most clinics will offer a course of lighter peels, which so you get to the same result, but over time. I don't think we mentioned laser and IPL for pigmentation, even when we were
didn't,
on.
I think, and let's just go back to that, because
very quickly.
Do you think it works well, laser?
Yeah, totally. IPL, people forget IPL, intense pulse light. We know of it for hair removal, but it's brilliant for hitting pigmentation in the face, and it will go after red pigment from kind of thread veins and stuff, or brown pigment from age spots. So that's great. And there is, you know, it's quite an old workhorse for treatment. Everywhere will have it, but people who know what they're doing with it. And it's not expensive, and you don't need that many courses. Brilliant on the hands, face, you know, neck and chest, wherever. There's a new version of it coming through from America. There's one called Broadband Light. That's the same kind of thing. It's like IPL on steroids. You know, this stuff is out there, and it's less. I find it more tolerable than laser. So because people always think, oh, laser might be a bit of a big step. And I know, like we're saying, these treatments are more expensive than skincare, but
IPL is a very good starting point. Yeah, that's great.
Yeah, and it works.
And it is true, Alice, that sometimes the oldest things still work really well, and one needn't go off the newest. We've come to the end of time, but I just want to say to everyone, I hope you've enjoyed it. And I think we've only just tipped the surface. But if you want to know more, and if this has sort of piqued your interest, that you would consider that you want to do, you know, kind of deeper, more long-term things for your skin, then please go on to the tweakmentsguide.com. And Alice has phenomenal information there. As you can tell, you have so much information inside your head. I love it. And it was a pleasure having you on. Thank you so much.
Okay.
Bye. Bye, everybody.